Fruit juice, daily meat, a cup of coffee. Most people assume these are harmless during pregnancy. Some of them are not. Certain food choices during pregnancy can quietly raise the risk of infections, birth defects, and poor fetal growth. The scary part is that most of these mistakes come from food people consider completely normal. I'm Dr. Bibusan Basnath, an internal medicine physician practicing in the United States for the last 10 years. And in the next few minutes, I'm going to walk you through the 7 biggest pregnancy food mistakes, backed by clinical guidelines and real research. Not to scare you, but knowing these things can protect both you and your family. So stick around with me. Mistake number 1, eating undercooked meat, eggs, or seafood. This one catches most people off guard. Raw undercooked meat, eggs, and seafood carry bacteria and parasites that are dangerous at any time. But during pregnancy, your immune system is naturally suppressed. That makes you and your baby far more vulnerable. Hot dogs and deli meats needs to be heated until they are steaming hot before eating, not just warm, steaming hot. Raw eggs in Caesar salad dressing, homemade eggnog, or raw cookie dough off the table. Should not be on a plate at all. Raw fish and shellfish, even the sushi that contains raw fish included. Parasites and norovirus are the real risks here. Cook it through every time, no exceptions during pregnancy. Mistake 2, eating unpasteurized dairy or soft cheese. This one is often overlooked because soft cheese seem very harmless. They are not. Unpasteurized dairy and certain soft cheese like feta, brie, blue vein cheese, and even queso fresco can carry listeria. Pregnant women are 18 times more likely to develop a listeria infection than the general population, and fetal listeriosis carries a mortality rate of almost 35%, depending on the stage of pregnancy. So check the labels. If it says unpasteurized or made from raw milk, skip it. Stick to hard cheese or anything labeled pasteurized. Never choose unpasteurized. Mistake number 3, eating high mercury fish. Fish is genuinely healthy during pregnancy. We all know that. Omega-3 fatty acids from fish support your baby's brain and eye development. But certain types of fish carry mercury levels higher than normal. That can cause neurological damage in a developing baby's brain. The ones to avoid completely are the sharks, swordfish, king mackerel, tilefish, and tuna sticks. Even canned tuna should be limited to around 20 ounces per week. This is roughly 2 to 3 servings only. So what are the safer choices? Salmon, sardines, shrimp, catfish, tilapia, you name it. 2 or 3 servings a week of low mercury fish actually benefits your baby. The goal is to not avoid fish at all. It is to choose the right ones. Mistake number 4, drinking too much caffeine. This is the one most people push back on, and I understand why. For a lot of people, their morning coffee is non-negotiable. Mine too. The science is clear though. Higher caffeine intake during pregnancy is linked to lower birth weight and other complications. The recommended maximum caffeine during pregnancy is 200 milligrams per day. This is roughly equal to 1 to 2 small cups. A single large coffee from many food chains can already hit that limit though. And caffeine is just not in coffee, tea, soda, energy drinks, and even some medications contain caffeine. 200 milligrams per day is the seal, not a target. Less is always fine. Mistake number 5, skipping folate-rich food. This is not about avoiding something harmful. This is about making sure you are getting something essential. Folate is critical for your baby's brain and spinal cord development. Neural tube defects happen in the first few weeks of pregnancy, often before many women even know they are pregnant. Guidelines recommend starting 400 micrograms of folic acid daily at least 4 weeks before conception and continuing throughout the first trimester. Food sources including leafy greens, beans, lentils, and fortified cereals can definitely help you out on this. But most doctors will recommend you a prenatal thinning to make sure you are consistently hitting your target. If you're planning a pregnancy or think you might be pregnant, folate is the one thing you should never ever delay. Now, mistake number 6, drinking any alcohol. I want to spend a little extra on this one because there's still a lot of confusion around it. No amount of alcohol has been proven to be safe during pregnancy. Not a glass of wine, not an occasional beer. non-nothing. We have heard about fetal alcohol spectrum disorder. Even low to moderate alcohol consumption has been linked to reduced fetal weight, lower birth weight, and effects on early development. The question is not about how much is okay. The question is, why do you take any risk when the downside could affect your baby's entire life? The short answer, strictly no alcohol during pregnancy. Mistake number 7, not getting enough proteins and iron. The last mistake is not about what to avoid. It's about what too many pregnant women are simply not getting enough. Protein supports the mother's and the baby's growth and development. Iron helps prevent anemia and ensures that there is enough oxygen reaching the baby through the blood. Iron from animal sources, what is called a heme iron, is easily absorbed by your body. But if you're on a plant-based diet, you are iron sources like lentils or spinach, and pairing them with vitamin C will definitely help your body absorb them better. A well-rounded prenatal vitamin can cover with the gaps though. But food choices still matter. Eggs, lean meat, dairy, beans, and leafy greens should always be on your regular plate. And omega-3 fatty acids, particularly DHA, from those low mercury fish 2 to 3 times a week directly supports a baby's brain and eye development. Pregnancy comes with enough to think about. Food does not have to be a constant source of anxiety though. But these are 7 things worth knowing because the risks are real and most of them are completely avoidable. Avoid undercooked meat, eggs, and seafoods, unpasteurized dairy, and soft cheese. Stay away from high mercury fish. Keep your caffeine under 200 milligrams a day, and do not skip your folate. No alcohol, and make sure you have enough proteins and iron. We want to make sure that these are showing up consistently in your diet. These are not restrictions. These are tools, and these tools are to help you during your pregnancy. The more you know, the more confidently you can protect your baby from day one. If this has helped you, share it with someone who is pregnant or planning to be. It could genuinely make a difference. Subscribe to eHealthyinfo for more clear, science-backed health content. We got you.